United States is becoming more culturally and linguistically diverse, with an increasing number of individuals that have limited English proficiency residing in the United States. The language barriers in healthcare institutions become even more prevalent and costly, both medically and financially. Problems stemming from language barriers are not exclusively found in the United States. Due to international travel becoming more common and accessible for students, tourists, businessmen, and immigrants, hospitals and healthcare providers are expected to prepare, accommodate, and provide the same quality of care for foreigners as well as their native tongue-speaking countrymen. Since the incorporation of the Patient Protection and Affordable Care Act into the U.S. legislature on March 23, 2010, there's been an influx of patients who are now able to afford medical care. With the growing availability and access to healthcare in medically underserved communities, language barriers that exist between patient and physician become even more of a detriment. This in turn causes an increased risk of consequences such as malpractice lawsuits, unnecessary emotional and physical distress, unwanted procedures, and deaths. To be deemed capable in interpretation of medical information, the individual must be knowledgeable in ethics-related issues, confidentiality agreements, medical practice standards, and the responsibilities, and most of all medical terms in both English and the non-English language that they specialize in. Currently, most hospitals have two types of interpreters: telephone interpreters and on-site interpreters. Charged with the responsibility of being the liaison between patients and healthcare provider, medical interpreters are trusted with vast amounts of personal information and the duty of providing a professional and unbiased line of communication to improve the patient's overall well-being. Responsibilities include 1. Being the patient advocate and actively supporting change in patient health with clear rationale. 2. Being the cultural and message clarifiers who facilitate communication between patient and provider. And 3. Being the message converters who follow standard healthcare practices along with upholding laws, regulations, and policies. Precautions in combating language barriers have been made since the 1960s. Title VI of the Civil Rights Act, proposed in 1964, states that no person in the United States shall, on the grounds of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subject to discrimination under any programs or activity receiving federal financial assistance. The Department of Health and Human Services issued requirements targeting healthcare providers specifically, stating no person may be subjected to discrimination on the basis of national origin in health and human services programs due to having a primary language other than English. We now turn our attention to issues in language interpreting today domestically in the U.S. Considered limited English proficient, these patients would encounter additional communication issues with their primary care physicians or medical specialists. Currently, each state has its own legislative requirements for medical interpreters. However, in most cases, training methods and supervision of practicing interpreters are lacking. Oregon is a primary example of issues in the system. Despite having a written and oral test, a large percentage of interpreters are neither qualified nor certified. There are 3 levels of registered interpreters: registered, qualified, and certified. With an estimated 3,500 employed interpreters in the state, only 25 are certified and 16 are qualified. In most instances, there is no registered interpreter on site. Unregistered bilingual medical staff, friends, or even family members, regardless of age, are given the responsibility of interpreting for the patient. This may cause selective interpreting, misunderstanding, decreased compliance to medical regimens, overall unnecessary increase in hospitalization, and drug complications for these individuals. Considering the legality of these issues, there have been many claims, including failure to translate important documents like discharge papers and consent forms, and malpractice cases oftentimes are initiated due to harm or death of a patient. Problems in this field are hard to solve because training is expensive. Many hospitals turn to technology. Companies such as Stratus Videos provides a video calling service via iPad for $1.50 per minute and have boasted 83,000 total interactions in 2013. However, services like these are hard to come by in isolated hospitals that find it unnecessary to provide and pay for these services. Hospital staff often ignore or do not follow policies because of time pressures of incoming patients, lack of knowledge about these services, or procedural difficulties in arranging for interpreters. Looking at this issue financially through data from various cases, we can see that the amount of damages paid can go over $200,000. The amount of legal fees paid can go over $400,000, and the amount of damages demanded by the patient or their families can go up to $10 million. From these figures, we can see how expensive this issue can potentially become. So what makes a good interpreter? You must be skilled at your language of expertise and have a large vocabulary. You must have people skills and be able to communicate with a diverse demographic of patients. You must be educated and trained in healthcare procedures. You must be available on demand. And you must be willing to fill an important niche in the hospital community. The objective of our proposed program is to incorporate the ethnical, cultural, and linguistic diversity present at Rutgers University into the undergraduate and graduate education of students pursuing a career in the health sciences. Targeted at students who do not want to lose their culture and identity in the bustle of college life, this program lends a hand to students to apply their sense of nationality towards practical uses as they pave their way towards a professional career. The beauty of this program is that it uses what Rutgers already has in bulk of: facility, faculty, funding, international connections, and thousands of eager students striving for a career in healthcare. Our project is perfect for Rutgers University New Brunswick, whose threefold mission consists of 1. Providing for the instructional needs for New Jersey's citizens through educational programs, 2. Contributing to the social well-being of the state and aiding its economy, and 3. Performing public services in support of the needs of the citizens of the state. By offering this program at Rutgers, graduating students with a certificate will have greater employment options. Quality of Rutgers health sciences and language-related academic programs and study abroads will be enhanced. Surrounding New Brunswick communities will be provided with high-quality interpreting services from students familiar with the area. And Rutgers will finally be a part of a small group of innovative universities with medical interpreting certificate programs. If our project becomes successful and other schools begin adopting this model, overall healthcare would be more internationally friendly towards patients of all backgrounds and lower the overall cost of language services. Thanks for watching.